Today we will be talking about cholinoreceptor blocking drugs.
So, cholinoreceptor antagonists, like agonists, are divided into muscarinic and nicotinic subgroups on the basis of their specific receptor affinities. Ganglion blockers and neuromuscular junction blockers make up the anti-nicotinic drugs. So, basic pharmacology of the muscarinic receptor blocking drugs. Muscarinic antagonists are sometimes called parasympatholytic because they block the effects of parasympathetic autonomic discharge. However, they do not lyse parasympathetic nerves, and they have some effects that are not predictable from block of the parasympathetic nervous system. Naturally occurring compounds with anti-muscarinic effects have been known and used for millennia as medicines, poisons, and cosmetics. Atropine is the prototype of these drugs. So the chemistry and pharmacokinetics. First is the source and chemistry. Atropine and its naturally occurring congeners are tertiary amine alkaloid esters of tropic acid. Atropine is found in the plant Atropa belladonna or deadly nightshade and in Datura stramonium, also known as Jimson weed, Sacra datura or thorn apple. So this is the structure of atropine. This one. Sorry. So chemistry and pharmacokinetics. Absorption. Natural alkaloids and most tertiary antimuscarinic drugs are well absorbed from the gut and conjunctival membranes. In contrast, only 10 to 30% of a dose of a quaternary antimuscarinic drug is absorbed after oral administration, reflecting the decreased lipid solubility of the charged molecule. So for the distribution, significant levels are achieved in the CNS within 30 minutes to 1 hour, and this can limit the dose tolerated when the drug is taken for its peripheral effects. Scopolamine is rapidly and fully distributed into the CNS, where it has greater effects than most antimuscarinic drugs. In contrast, the quaternary derivatives are poorly taken up by the brain and therefore are relatively free at low doses on the CNS effects. So for the metabolism and excretion after administration, the elimination of atropine from blood occurs in two phases. The T1 half of the rapid phase is 2 hours of the slow phase and approximately 13 hours. About 50% of the dose is excreted unchanged in the urine. Most of the rest appears in the urine as hydrolysis and conjugation products. The drug's effect on parasympathetic function declines rapidly on all organs except the eye. So, as for pharmacodynamics, for the mechanism of action, atropine causes reversible blockade of the cholinomimetic actions at muscarinic receptors. That is, a blockade by a small dose of atropine can be overcome by a large concentration of acetylcholine or equivalent muscarinic agonist. When atropine binds to the muscarinic receptor, it prevents actions such as the release of inositol triphosphate and the inhibition of adenylyl cyclase that are used by muscarinic agonists. So for the organ system effects, muscarinic antagonists have no intrinsic activity and they can produce effects only by blocking activation of muscarinic receptors by muscarinic agonists or by neuronally released acetylcholine. There in the table. Sorry. So for the clinical pharmacology of the muscarinic receptors blocking drugs, for clinical uses in the CNS, scopolamine is standard therapy for motion sickness, benztropine, biperidine, and trihexyphenidyl are representative of several antimuscarinic agents used in Parkinsonism. For the eye, Antimuscarinic drugs are used to cause mydriasis. In descending order of duration of action, these drugs are atropine, homatropine, cyclopentolate, and tropicamide. These agents are all well absorbed from the conjunctival sac into the eye. For bronchi, parental atropine has long been used to reduce airway secretion during anesthesia. So, ipratropium is quaternary antimuscarinic agent used by inhalation to promote bronchodilation in asthma and chronic obstructive pulmonary disease or COPD. In the gut, they are used in the past to reduce acid secretion in acid peptic disease but are now obsolete for indication. They can also be used to reduce cramping and hypermotility in transient diarrheas. In the bladder, oxybutynin, tolterodine, or similar agents may be used to reduce urgency in mild cystitis and to reduce bladder spasms after urologic surgery. So, these drugs are slightly selective for M3 receptors and are promoted for the treatment of stress and incontinence. So, in cholinesterase inhibitor intoxication, atropine, if given in large doses, reduces muscarinic signs of poisoning, and acetylcholine inhibitors. Pralidoxim is used to regenerate active acetylcholine. So for the toxicity, because every drug has a toxicity, blockade of thermoregulatory sweating may result in hypothermia, hyperthermia, or atropine fever. This is the most dangerous effect of the antimuscarinic drugs in children and is potentially lethal in infants. Sweating, salivation, and lacrimation are all significantly reduced or stopped. So, moderate tachycardia is common, and severe tachycardia or arrhythmias are common in large overdoses. In the elderly, important toxicities include acute angle closure glaucoma and urinary retention, especially in men with prostatic hyperplasia. Constipation and blurred vision are common adverse effects in all age groups. So for the contraindications, these agents should be used cautiously in infants because of the danger of hyperthermia. The drugs are relatively contraindicated in persons with glaucoma, especially the closed angle form in men with prostatic hyperplasia. So for the nicotinic antagonist, in ganglion blocking drugs, blockers of ganglionic nicotinic receptors act like competitive pharmacologic antagonists, although there is evidence that some also block the pore of the nicotinic channel itself. So these drugs were the first successful agents for the treatment of hypertension. So these drugs, hexamethonium, mecalamine, and several other ganglion blockers were extensively used for this disease for hypertension. So the adverse effects of ganglion blockade in hypertension are so severe that patients were unable to tolerate them for long periods. So for the neuromuscular blocking drugs are important for producing marked skeletal muscle relaxation that is important in surgery and in mechanical ventilation of patients. So for the cholinesterase regenerators, pralidoxim is a prototype cholinesterase regenerator. So they have an extremely high affinity for the phosphorus atom in organophosphate insecticides. So because of the affinity of the oxime group for phosphorus exceeds the affinity of the enzyme active site for phosphorus, these agents are able to bind the inhibitor and displace the enzyme if aging has not occurred. So the active enzyme is thus regenerated.